Hello, I'm Dr. John Sweetenham, the Associate Director for Clinical Affairs at UT Southwestern's Harold C. Simmons Comprehensive Cancer Center and host of the ESCO Daily News podcast. My guest today is Professor Piotr Rutkowski, who leads the Department of Soft Tissue and Bone Sarcoma and Melanoma at the Maria-Sklodowska-Curie National Research Institute of Oncology in Warsaw, Poland. Professor Rutkowski is also the Deputy Director for the National Oncological Strategy and Clinical Trials and serves as President of the Polish Oncological Society. Professor Rutkowski spoke with us earlier this year as millions of people were fleeing the war in Ukraine, and he described the really remarkable response from both the Polish government and his institution to this crisis. He's back on the podcast today to tell us about cancer care for Ukrainian refugees 5 months into the conflict and how health systems are coping with the influx of millions of refugees. He will also share his insights on the kind of support that will be needed long-term to care for these patients in the future. Our full disclosures are available in the show notes, and disclosures relating to all guests on the podcast can be found on our transcripts at asco.org/podcasts. Professor Rutkowski, thank you for being on the podcast today. It's been about 4 months since we last spoke. How are you doing?
I'm very privileged we can speak again. I'm talking probably on behalf of many of Polish physicians and citizens involved with this dramatic situation of war in Ukraine and helping our patients and citizens from Ukraine. And I feel okay, but of course the situation is still dramatic, and we don't know what will happen during next months. First, what has been changed for this last 4 months, it is the number. So as for now, almost 5 million people from Ukraine cross the border between Ukraine and Poland, and we can estimate that about 3 million of refugees stayed temporary or maybe even permanently in our country. This is completely new situation because it means that it's about 10% of our citizens now. And what didn't change, that still the cancer care for Ukrainian patients is the extension of regular cancer care within our National Oncology Network and our National Health Fund. It is Polish insurance system. And this is the same like served to patients in Poland. And so all refugees from Ukraine are entitled to receive the care as same as citizens of Poland. Still, this extraordinary legislation, which was adopted by Polish Parliament, cover all refugees of war, social security and health insurance. And we have better situation because all comprehensive cancer centers or major cancer centers organize the help with a hotline, not only on the level of the whole country, but also on the center level in Ukrainian language. And majority of these centers have the staff speaking in Ukrainian language. Moreover, what can I say as a president of Polish Oncological Society? Recently, with help of some educational grant, we bought electronic translators for major oncological cancer centers and transfer to these centers so they can help in the situation like in emergency situation when we haven't access to live translator. So they can be used in this situation. And in my opinion, it is very, very helpful.
Yes, thank you. It's really quite extraordinary to grasp your patient population almost overnight increased by 10%. That's just quite extraordinary. And what aspects of the cancer care would you say are working well at the moment? And what are your greatest remaining challenges with this population as of now?
First, what is challenge for pediatric cancer population, and about 1,000 children with cancer were evacuated from Ukraine. They were transported to the Ukrainian hub near Lviv in western Ukraine and thereafter to Polish hub. And with help of many NGOs and many organizations, many hospitals from whole Europe, but also US, and Canada. Many institutions help within this operating to transfer after triage the pediatric, so children with cancer, to Polish, German, US physicians. So more than 1,000 children were transferred to this different hospital around the world. But of course, when we look at the specific other problems with cancer population from Ukraine refugees, first, that we have a very extraordinary situation in demography, because majority are women with children and only very small percentage of males, mostly in older age. So when we looked at the cost of hospital admission of patients from Ukraine in May, this is what I look at the data until May. So of course, the signs and symptoms not and abnormal laboratory tests, not otherwise classified. So generally different conditions, mostly internal condition. The second one were obstetric gynecology, so pregnancy, childbirth, etc. And the third in the rank were neoplastic diseases. And I looked also carefully how it looks on the level of our institution, because Maria-Sklodowska-Curie National Research Institution is the largest oncological center in Poland, and we have the central part in Warsaw, but also we have two branches in southern half of Poland. So when we looked at the populations altogether, we had about 1,000 visits with new patients in our institutions. And number one were breast cancer, and second were gastrointestinal, and thereafter gynecology. And the fourth in the rank were melanoma and also soft tissue tumors, so rare cancers probably related to the younger population, but melanoma was also relatively frequent. But number one were breast and reconstructive in all our branches. And of course, the distribution of patients is also different in whole Poland. The largest number are in our region, because probably in Warsaw region, because it's the largest city in Poland, so they have a lot of relatives or colleagues. So about 20% of patients from Ukraine are concentrated in our region, but more than 10% are also near Katowice or Gliwice, so it's Silesia, and also near Krakow. So this central and southern eastern part of Poland have a majority of Ukrainian patients now. However, of course, some of the patients were also transferred to other parts of Poland. But as I said, in some of the departments, more than 10% of patients are now from Ukraine, especially in breast cancer units and also gynecological units. When I look at the department which I'm chairing, so Department of Soft Tissue Bone Sarcoma and Melanoma, we have mostly patients from Ukraine involved in treatment of advanced melanoma, some with earlier stages and some sarcoma patients, especially if they were contacted by physicians from Ukraine specifically for this type of disease. But generally, the stage of disease, it's a little bit more advanced. So many of these patients receiving neoadjuvant therapy in breast cancer, or they are going directly to treatment of stage 4 disease with modern drugs like immunotherapy or targeted therapy in melanoma. So this is also the real situation. One of my points which I want to mention, if the access to the cancer care, regular cancer care, probably is good for patients, but the problem with communication exists, and still I think that patients or citizens from Ukraine do not participate too much in prevention programs, because the participation in mammography, cytology for cervical cancer and other screening programs are at very low levels. So, of course, it's a new situation for these people, but still probably it will be one of the points for which we have to undertake some strategies, because we do not know how to get with information if they will be staying longer in our country, what we can anticipate for next months and even years. So this can be problematic because it means that we'll have more and more advanced stages of disease.
It's very interesting that you have, and of course not surprising, that you have this very skewed demographic of predominantly female patients. And I wonder whether you have any insights into whether the maybe resistance to screening is the wrong word, but the reluctance to be screened, is that, do you think, a reflection of screening services in Ukraine, or do you think it relates more to the current stresses and priorities that these patients face?
I think that it's first for our colleagues from Ukraine, it's a new situation and they still are not in the normal life. So I agree that first, of course, the participation in the screening programs in Ukraine, it's on the lower level, but still maybe the people do not consider staying here, staying at home, of course, and staying in their own country. So they are a little bit in between of normal life and living as refugees only. So they did not start all normal activities. And of course, the informations about the screening programs, about the normally functioning healthcare, it's also probably a little bit more difficult for them because they may do not understand all details of our healthcare. So I think that it is one of the points which we have to think for new strategical enterprises in next month. So as I mentioned, for normal access for healthcare, I do not foresee now that it's problematic. Of course, it can be problematic if we'll have a shortage of our personnel. So we will see, but still we can manage this on the regular level. But as I mentioned, when I talk to our colleagues from the Department of the Prevention, the percentage of the people who are coming for screening programs is very low as compared to the total number of refugees.
Yes. You mentioned that the future for many of the Ukrainian refugees is uncertain at the moment. Now that the heaviest fighting appears to be concentrated on the east of the country, are you seeing any signs that Ukrainian patients will be able to go home for their treatments at any point in the near future?
Yes, I think so. Some of the refugees even started to coming back home to the Western Ukraine, especially when they felt that it's a little bit safer. But as we know, still the situation on the front and the plans of Russian invaders are not predictable. So we cannot say how even we can behave in this situation. So, for example, in my hospital, we have the psycho-oncologist from Ukraine who first escaped from Donbas to Kharkiv. And when the Kharkiv was started to be shelled by bombs, so she escaped to Poland. So it's sometimes really, really dramatic fate for these people. So of course, the movements between the border is relatively high because some of the people are trying to come back because they feel, of course, more comfortable in their homeland, in the country when they can all speak own language. But others, I feel, that started to adopt in living in Poland, and we have more and more patients who are accompanied by people speaking Polish. So they started to try to live more normally in our country. I also noticed that we have some patients from Ukraine in the clinical trials. Of course, we also adapted the informed consent and some information sheet for Ukrainian language. So Ukrainian patients interested in taking part in clinical trials are also included based on normal inclusion criteria. This is also important that we can propose this to patients from Ukraine because if they want to stay longer, so they can get the extra treatment within the frame of clinical trials. What is also interesting that our National Science Center started to supporting researchers who are fleeing from war. And they prepared also the special funding scheme for researchers from Ukraine to encourage the grant winners to employ researchers from Ukraine on ongoing projects. So there are many specific actions to allow adapt the persons, the citizens of Ukraine in Poland to undertake normal work. We also allowed temporary working in the healthcare for physicians and nurses. And as it was announced recently by Polish Minister of Health, more than 2,000 physicians from Ukraine decided to work in Polish health system. So this is what we can do now.
I mean, I think your responsiveness and that of your government to this situation has been really remarkable and also remarkably quick. And as you've already pointed out, these patients are going to have needs for many months and many years to come. And you've touched on some of those, specifically the needs around cancer screening. Do you have any other insights into what you think the most pressing future needs for these refugees will be? And then what support your health system, which is presumably already overstretched, what additional support it will need to be able to cope with the ongoing demands and needs of this population?
I really appreciate the whole help from international community with material for our Ukrainian patients, but probably the next step will be a specific maybe EU fund for such healthcare system which are affected now by numbers of patients from Ukraine, because of course we are doing this with our internal Polish funds, but I don't know how it affect the next year with regular health service in Poland. So this is one of the points. And the second point, of course, which we always are afraid of, is the situation with the staff shortage for regular healthcare, because Poland, like generally in our part of Europe, we can see the shortage of nurses and educated oncological physicians. This is what we included in our national oncological strategy. However, we didn't anticipate that we'll have such extraordinary situation, which we can have to face on now. So these points can be one of the problems which can be raised during next month.
Yes, and so you've indicated the potential support from the EU and other international agencies, and I wonder if we could take that question a little bit further to the international oncology community, including organizations like ASCO, the European Cancer Organization, the American Cancer Society, and others who've been collaborating to support Ukrainian patients and the oncology community in Poland and in the region. How do you think the international oncology community can continue to respond and help in the coming months and years?
It seems that it's very continuous effort. So we have regular meetings between the national representatives, ECHO, as you mentioned, ASCO, and also some NGOs to discuss the most hot problems with the situation in Europe and also how we can find some solutions. And colleagues from Ukraine are also asking us about this specific issues like the access for radiation therapy and some possibility to transfer the patients because the equipment is not working perfectly in whole Ukraine. I think that this effort is very, very important. And I feel that it will be a very excellent platform for next month, maybe for next year. And I think that it's extraordinary because it was organized very fast and it was not temporary, but it seems that it will be continuous for a long time. And as I mentioned, this platform, we can exchange some materials, some information very quickly and in efficient way. So I would like to thank you, ASCO and ECHO, for organization of this platform.
Well, Professor Rutkowski, I want to thank you again for taking the time to join us for a follow-up discussion regarding the situation in your country with respect to Ukraine, and express once again our respect and admiration for the way that you and your colleagues and your country have responded to the crisis. It's been a real pleasure having you on the podcast again today. So thank you for joining.
Thank you very much. Goodbye.
And thank you to our listeners for your time today. If you're enjoying the content on the ESCO Daily News podcast, please take a moment to rate and review us wherever you get your podcasts.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.